Good evening everyone. Today I want to discuss certain aspects of hypertension and COVID-19 pandemic. Nowadays, the hypertensive patients are on antihypertensives regularly and they are suffering to get drugs. They have to stand in long queues in front of the medical shops because they have to maintain social distancing. Even if they are getting drugs from government hospitals, it is very difficult to travel during the lockdown period and they suffer to get drugs. In spite of that, there are so many postulations and so many theories and so many publications are there against the use of ACE inhibitor and ARBs for hypertension. And there is also a myth telling that the hypertensive people are more prone for COVID and the outcome following COVID also worse than the general population. So let us discuss one by one what the hypertension societies of various countries say about this. During the pandemic, there was an observation from American College of Cardiology. In the published paper on 6/4/2020, there was an observation that among the COVID people there were comorbid illness, hypertension to the tune of 30%, diabetes to the tune of 19% and coronary artery disease to the tune of 8%. And similar observations were there in another center also. And later on they told that there is no correlation between the ACE inhibitor and ARB usage and the susceptibility to COVID, and the outcome is also same for the ACE inhibitor ARB users as well as the other people. And Indian Society of Hypertension, they told some 4 points about the hypertension. One is those with hypertension are overrepresented among the COVID-19 and there is no relationship between the ACE inhibitor and ARBs and COVID susceptibility and the outcome. And all the antihypertensives can be continued. And antihypertension medication is same in the COVID patients also. And there are so many publications in the Lancet Respiratory Medicine 2020 and European Society of Cardiology statement in the Council on Hypertension also gives the same statement that antihypertension medications has to be continued and the usage of ACE inhibitor and ARB are encouraged to continue. And the old guidelines for hypertension holds good as of now. There is no new recommendation or guidelines for the COVID patients. And the routine contraindications like for example, beta blockers are relatively contraindicated if the patient is having COPD or severe lung signs and first degree AV block. So such contraindications we have to take care of. If the patient is having heart failure, the beta blockers has to be used. If there are associated respiratory symptoms, the beta blocker of choice, nebivolol can be used. Like that, certain modifications done in the previous guidelines only followed. There is no new guidelines recommended as of now. And it is recommended that all the antihypertensive patients has to check their BP in a home monitoring manner. They have to buy a BP apparatus and a digital BP apparatus that too, and they have to keep and they have to check regularly and as and when needed. And people on diuretics as antihypertensive therapy, they have to be used judiciously because of the summer climate and if they are suffering from fever or dehydration, they have to use it very cautiously. So such minor modifications can be done by asking the family physician over phone. And and if at all they develop symptoms also, they can contact very well over phone or WhatsApp or the social media to the treating doctor, and the telemedicine can be taken as a helping tool for treating hypertension. So there is no panic, there is no need to change the treatment guidelines for hypertensive patients in the COVID-19 pandemic. And I hope the COVID pandemic will end soon and we will meet you in person soon. Thank you very much.